And good afternoon, everyone. Thanks for joining us on our media briefing today. We'll get started. We have our CAO, Charles Mckee, who is on the call with us today. He's going to lead us off with some comments, and then we'll take some of our other participants. Good afternoon, Charles.
Good afternoon, Maya. Thanks for the time today, as usual. I appreciate the media, as I've said before, that it's a critical link in keeping our public informed and a critical link in a free society, in my opinion. And so the participation that the media provides on these media briefings is very important to me and to the Board of Supervisors and to the county overall, especially in these times, but not just in these times of battling COVID-19. I wanted to just comment on some of the reopening issues that are out there. I think that there's a lot of appropriate desire to open up, to get out, to enjoy beautiful Monterey County. And there's obviously the tension between that and what is good advice from our medical professionals about preventing the spread of COVID-19. The County of Monterey has done a tremendous job in flattening the curve and as they say, and keeping our numbers low. And that, in our opinion, is not by accident. It is by the compliance with the health officer orders, both from the county as well as the state health officer orders. Much of what we do here in Monterey County, as far as having restrictions on some of our daily lives, is based on the state's health orders. And at this point, as we look at some of the reopening possibilities, we are guided by the state and what the state will allow. We can't be moving any more quickly, excuse me, any more quickly than the state will allow. There's been a lot of discussion recently on the media about the ability to open up various sectors of the economy, especially restaurants. And there have been some different reports out there, I think, that may be taken out of context about what the state's order on reopening means, and especially with regard to restaurants. There's no ability right now for us to just open up restaurants here in Monterey County for dine-in service. If we want to do that, or any of those other sectors that are in stage 2 of the governor's 3-stage process, we must be sure to follow the criteria. And we can have a variance from moving through the process if we can show that we've met various pieces of criteria. And we're pretty good on a lot of them, but we're not it's not final that we've met all the criteria to have a faster reopening than what the state will allow. We are working on the plans to address all the criteria that the state has put in place for reopening, including for restaurants and other businesses that are out there. But I just want to make sure that the public is aware that just because the state is saying that things like restaurants can open soon, the message needs to get out that doesn't mean that we in Monterey County have met the criteria to do so. In addition, there are numerous pages of requirements for any eating establishment, any restaurant to actually open. So we want to make sure that the public is aware that those criteria exist for both the county to allow restaurants to open and for the restaurants themselves to open up. I think, as everyone is aware, last week we did start opening up different amenities here in the county and different industries. We talked about the construction industry, excuse me, and the golf industry here in Monterey County, 2 big pieces of our economy. And we want to make sure that any future openings follow similar criteria that both golf and the construction industry put together for their industries in order to open up safely. That said, uh, uh, there are always going to be people that are not paying close enough attention to what the criteria are, what the protocol should be. And we want to make sure that there's vigilance as we move through the process so that we don't have a surge and don't have a spike when we ease more of these restrictions, because the worst thing will be to our economy and to our well-being is have to reverse course and impose additional restrictions after we've opened up. So I appreciate the media getting that message out to make sure that the community is aware that we've done a great job in Monterey County flattening the curve, but that just pushes out the timeline a little bit, and we want to make sure that everybody continues to follow the restrictions, excuse me, as we reopen, so that we can continue this forward progress, and that the community can see that there is a way forward to having us get back to somewhat semblance of a normal lifestyle. With that, Maya, I will turn it back over to you and field any questions as we move forward.
Thank you very much, Charles. Next on our agenda, we welcome a county colleague who is a supervising nurse at the Natividad Emergency Department. She's going to give us a little bit of an inside view of what it's like in the department and all the work and the changes that have gone on at Natividad to care for COVID patients. She's Cassandra Caldera, and we welcome her to our media briefing. Hi, Cassandra.
Hi, thank you for having me. So I just wanted to talk a little bit about at Natividad, the emergency department, and really being kind of on the front lines and being that first essential healthcare worker who are seeing these patients as they come in. Natividad has done a great job at really changing our workflow to adapt and isolate and provide care for potential COVID patients, and continue to provide care to the county and to the rest of the population for any healthcare need that they have. And I think the county has done really great at flattening the curve. We've seen our numbers here at Natividad, they've decreased, obviously, the amount of patients we're seeing in the emergency department. But because of that, it really allowed us to prepare and really set up and streamline our process, our intake process. So there's been lots of changes, and I have to say our staff here in the emergency department, amazing. As all this continues to come to fruition with COVID, we don't know, there's a lot of unknown. So being prepared and planning has been really helpful for us. We've, if you've been around the area, there's lots of tents set up, and that has allowed us to set up a specialized tent for just potential COVID patients. We have a second tent now that is helping with overflow of non-COVID patients. And we really changed our screening. So we have a nurse out front who is screening every patient that comes in and doing a set of vitals, a temperature, oxygenation, a pulse, and screening them whether or not they need to go to our tent and be screened for COVID, or go to our main emergency department and be treated for their complaint. We've also been able to increase our isolation within our emergency department. We have added negative pressure rooms. There had never been negative pressure in our emergency department before, and now we have 2 rooms. We also have another sectioned off area that has 3 isolation rooms as well, so that we can really isolate those potential patients, keep the other patients who are not COVID related, there for COVID related issues, separated and safe. It's allowed for safety of our staff and safety of any person coming into the emergency department. We are starting to see our numbers in our emergency department increase slowly. Not so much with potential COVID patients, but more of general emergency issues and patients coming back to the emergency department, or who hadn't sought out care for an extended time and now are coming in. Our acuities are starting to go up a little bit, which is good, I guess. But we want the community to know that come to the emergency room if you need to come. Don't hesitate to seek care if you need care. We are seeing those patients who are waiting and they are sicker than they should be, or, I mean, we're noticing the higher acuity of our patients. But as for our care, I think we feel protected, we feel safe here at Natividad. I know I do. I don't know if there's any questions that anybody has about the emergency department or.
Well, Cassie, in fact, we could probably do questions now for you if
Yeah.
I don't know if your time is limited. If any of the people who are on the call, if they have any questions for Cassie, you could go ahead and ask them now, and then we can let her get back to work. Giving people a minute. Here's a question, Cassie. I think this could be for you. This came through on our chat. What is the treatment like for patients who test positive for COVID-19?
So treatment on COVID patients is really supportive care. Depending on everybody, as we're seeing too, everybody has different symptoms. Some people have no symptoms. Some people have really mild symptoms. Some have more severe. So it depends on patient to patient. We do try to follow CDC recommendations for care. And I know our providers are always looking at what's current and what's recommended for care of these patients, but it really is supportive and treat the symptoms that the patient may have. But it does vary from case to case.
Right. Are there any other questions for Cassie while we have her on the call? I'm just hearing doors close, so I think that that's I think that that's a no. Thank you very much for joining us and giving us a little insight into well, wait.
There's another one.
There's another one. We got one. Are there any long-term issues that you're seeing from people who recover from COVID-19, or is it still too early to tell?
I think it's still a little too early. We will have, and we do have those patients who have been hospitalized long-term, and their recovery might be different than somebody who's just had a little episode of pneumonia that needed some antibiotics and treated and out the door and sent home. It really, I think it's still a little too early to see what the long-term effects and recovery for these people. I think in the months to come, we'll know a little bit more.
All right, thank you, Cassie. And I think that's all the,
even though another one.
Oh, no, I'm thinking that one's not for you. You don't want that one. Thank you very much for joining us, and we'll let you get back to work. And thanks for all of your hard work at Natividad.
Thank you.
All right, our next presenter will be Under Sheriff John Moreno, who is on the line. He has some issues he wants to talk about with a scam alert. Hi, Under Sheriff.
Hi, Maya. Thank you. We put some stuff out on social media yesterday. There have been some scams related to COVID-19 and the shelter in place. Specifically, some of the residents in our county have been receiving calls from people posing as members of the Monterey County Sheriff's Office and reporting that they're collecting on a judicial warrant signed by one of our Superior Court judges. And they're directing people to go into local businesses to use like a wire service for money to transfer. And the reason that they're stating is that because of the shelter in place order, the lobby at the sheriff's office is closed. So the way we're collecting fees or fines on warrants is via this new process. And at least in one of the calls, the person posing as a member of our agency was quite threatening, really put some fear in the caller. And we want to make sure that everybody knows that, you know, we don't collect fines or fees via phone calls or trying to get people to use a wire service. We can still get people into our lobby if people have business to transact. But unfortunately, while people are really trying hard to make it through during the shelter in place and abide by the various health orders, some of the criminals out there just don't take any time off, and they're using this, they're trying to use it to their advantage. They're trying to prey on people's fears and uncertainties and trying to scam money. And the big thing is We're not going to ask for money or personal information or things like that over the phone. And we really appreciate our media partners that either retweeted our tweets or shared our Facebook posts. And we just want to make sure the community knows. If you get a call from somebody posing to be a member of our agencies, then you can certainly call us and we can get you connected with whoever the real legit person is to set those fears at ease. I see a question about how many people have fallen. We don't know of anyone that's fallen for the scam yet, but we did get 3 different reports yesterday of people that got the scam, and they were really uptight. So we want to get the word out as best we can. Don't give out your personal information or financial information via phone, internet. And if you have any questions as it relates to us, please call us, and we can certainly try and set the record straight. We don't want to see anybody fall prey to this scam. Thanks, Maya.
Thank you. Another question came in, just a follow-up to the one you just answered. Are the scammers targeting any particular group of people?
Not a particular group. We do know that one of the calls went to an employee of the city of Salinas. Another one was routed us through a county employee. So we don't have any one particular group. And we don't know fully about the third. The reporting party had heard from a friend about the third. So that's all we know of yet, but just stay vigilant, be smart, don't give that information out. And we don't want to see anyone lose their privacy, get their identity stolen, or lose any money because people are trying to take advantage of the shelter in place.
All right, thank you very much, Under Sheriff. And we'll let you go on that one. And there may be some other questions, but we're going to get to our Dr. Moreno, who is on the line, and we want to give him a chance to give an update on public health. Hi, Dr. Moreno.
Hi, Matt. Good morning. Good afternoon. Hello, everyone. So Ed Moreno, Monterey County Health Officer. I'll just quickly go through what updates I have, and then Maya, I can take questions. So in the area of containment, which many people are familiar with, we continue to test more people in Monterey County. We have so far at least 4,000 test results that have been reported to our health department. And we, as you folks know, we've been able to receive 2 Optum-served testing sites here in Monterey County. One's in Salinas, one's in Greenfield. And we know that there's been at least 830 people who've signed up and have been tested or have had specimens collected. A portion of those results are back. Those are being, the test itself is being done at Quest. And Quest has already been providing test results to our health department. So these additional tests that are coming from Optum are being reported to us from Quest, who's doing test results for hospitals and other healthcare providers. So that laboratory is also sending those test results to us. So we are really grateful for the state having agreed to give us 2 test sites. And we still need more people to attend the sign up for the Greenfield testing location as well. As far as the, again, with containment, once we get test results on with confirmed cases, our next step is to contact those confirmed cases. And we do that with our case investigators and our contact tracers. So as I mentioned, we have a little over 30 people now working on that, and we hope to get to at least 12 more soon. And with some assistance from the state, we're going to be increasing the number of trained individuals that we can redirect. So as we're adding more people, those additional people may not have many cases to work on at this time, but they'll at least be trained and have some experience so that if and when we do see more cases, as the numbers of cases on a daily basis increases, we can redirect trained staff to step in and take on more of the cases and also more of the contacts. So according to the state, we need about 65 individuals for a county our size. So we're making progress towards that, and we'll keep working towards that number, whether or not we have an increase in daily increase in cases. And unfortunately, we continue to our team continues to reach 97 to 99% of confirmed cases, and 97 to 99% of individuals are identified as close contacts. So we continue to perform pretty well in getting a hold of these people and getting them into isolation. And if they can't isolate, working with our Emergency Operations Center to identify sheltering opportunities for them to isolate, and then working with the close contacts, and if necessary, employers who have employees that might have been in close contact with the case to make sure that they understand what's required for quarantine of employees that have been exposed. Let's see, as far as, I'll jump to readiness, the roadmap and readiness. So we have the governor and his team have put forth the roadmap for California, and just recently, the governor recommended that retailers in California be allowed to reopen with curbside service, and each retailer who decides to reopen and provide curbside or delivery service must follow the state's requirements for protocols, to have protocols in place to protect the workers. So curbside service and delivery minimizes the amount of exposure between the employees and the customer. But the employees are still working at the retail locations for hours, for shifts, which could be a few hours to 8 hours or more. So they're working together in the facility. So the governor's put out guidance that each retailer has to follow to protect the workers who come to work to provide that curbside or delivery service. So every retailer who's taking advantage of this needs to make sure that they have those protocols in place and be ready to share those protocols with their employees if the employees want to know what steps the employer is taking to protect them when they come back to work. We're currently working with, we have been working closely with Santa Cruz County here on the Central Coast throughout the pandemic. I've worked with the health officer on assessing the status of COVID cases, COVID hospitalizations and deaths in our region. We've worked together on determining what type of restrictions are necessary to slow the spread and what kind of releases of restrictions are appropriate given the trends here in Monterey County and Santa Cruz County. And we're continuing to work with them on looking at not just the governor's recommendations for the roadmap to recovery, but also what's most appropriate for us locally, because every region of the state has their own circumstances related to the pandemic, and we need to continue to look at what's most appropriate for us. So we're continuing to work with Santa Cruz County Director of Health and Health Officer looking at roadmap for Monterey County and Santa Cruz County. And as a part of that, the governor has put out there the readiness requirements to further advance through release of restrictions during this pandemic. And we are, as a department and as part of the Emergency Operations Center, and also working closely with our hospitals and skilled nursing facilities, looking at those requirements that the governor's put out. So one of the readiness requirements is based on epidemiology, number of cases and number of deaths. And we've looked at that. And at this time, although we have, fortunately, we've had a steady increase in, a steady, slow increase in the number of cases and deaths in Monterey County. At this time, it doesn't appear that we've quite met the governor's readiness requirements epidemiologically. But I don't want people to be disheartened about that. I really do think that as a county, as a community, we've done a pretty good job at slowing down the spread of COVID-19. So I'm very happy for that. Moving forward, in order to meet that readiness requirement, we'll have, our ability to meet that readiness requirement will depend on ongoing compliance with people staying at home if they don't need to leave their homes, and social distancing and other limitations and restrictions on activities that are currently allowed. And it will also depend in part on our ability to continue to isolate people who have confirmed COVID-19, and also our ability to get people to understand the importance of putting themselves in quarantine so they don't, so we can continue to slow the spread and maintain low case numbers and deaths. The second area is testing volume. According to the governor, a county the size of Monterey County should be testing over 600 people a day. I think I know that we've increased our testing capacity. Testing is now available at hospitals, in the hospital laboratories, still in our laboratory, and now with some clinics like the clinic in Soledad and OptumServe. So the number of facilities and access for during testing and access to testing has improved in Monterey County. Now what we need are for people to, if they're sick, they have symptoms of COVID, call their primary care provider, and if they think they need care, seek care if necessary through the emergency department to determine whether or not any additional health care is required, particularly if people have shortness of breath or chest pain, and be tested. But even for those that only have mild symptoms and otherwise wouldn't go to the emergency department and have no symptoms, the OptumServe is the place for people to go to see if if they have the virus and if they're infectious. Because if they're infectious, it's better to know that it's better for a person to know that they're infectious so that they can take the measures necessary, including isolation, so that they stop spreading it to other people in their household and to people in the public and people at work. So we're not there yet, and we really, in order to meet that, we really need people to get out there and take advantage of the additional testing that the state of California has provided to our county. There's also we also are outreaching to healthcare providers and through advocacy groups to get the message out. We are working with Optum to and have asked the OptumServe, the company that's providing this testing, to expand availability of additional languages other than English, expanding on Spanish, and then trying to make additional languages besides English and Spanish more readily available, so that people who don't can go online and phone in and call in the preferred language to sign up for this. I do want to let people know that I did confirm with OptumServe today that people with symptoms can still sign up to get tested at OptumServe. And what I was told by the liaison for the state of California for OptumServe, who's working closely with local health departments, I was told that that people will not be turned away if they show up and they have some symptoms. The folks there are prepared for that, so people should get tested, and it's open to the general public now. We really wanted first responders and healthcare providers and essential workers to get themselves tested and their families tested, but it's open to the general public. You don't need to be working in a clinic or a hospital or working in a police department to make an appointment and get tested. Anyone can sign up and get tested. There is no charge. They will ask if you have insurance. Optum will charge and bill your insurance, but they're not going to ask you for a copay, and you shouldn't be getting a bill for any of the OptumServe testing services that are provided. So, and anyone that does not have insurance will not be charged as well. The state has made arrangements to pay for cover those services. As far as containment, that's another readiness measure that the governor has laid out for us, and that is, as I mentioned, it's basically increasing the number of staff. And I'm feel good about the progress that we've made in increasing the number of individuals that are trained to contact cases and isolate them, and then move on and contact their close contacts and get them in quarantine. So we're making good progress there as well. And another requirement for containment is that we have sufficient opportunity for homeless individuals to be put in shelter. And we're working closely with the Emergency Operations Center, who's actually taking lead on this, to identify as many opportunities that we can take advantage of to offer shelter to those that are homeless, and to get them out of situations where they're more likely to be exposed in the community, and offer an opportunity to have shelter with regular meals and a bed, a shower, sink for them during this pandemic. So we're working on that to try to increase that capacity to improve our readiness to move forward. And then finally, two more things. The hospitals have to demonstrate capacity for surge, and our hospital system needs to have, I think it's at least 35% increase in bed capacity in Monterey County. So the hospitals have made good progress, and I hope soon we'll be able to get commitments from the hospitals in terms of what they feel confident that how confident they are in being able to stand up additional beds, and if there are any limitations such as staffing, at least we can work with that and determine what our realistic and surge capacity is, and what we might be able to achieve under maximum surge. And then finally, the issue of personal protective equipment. Right now, or up until now, many of our skilled nursing facilities and hospitals have been dependent upon the state and federal sources for personal protective equipment by submitting to us resource requests that we submit to the Emergency Operations Center, and that goes up to the state. And those requests for masks and gowns and gloves and face shields some of those requests have been answered by the state, and we've received some of those and distributed to the skilled nursing facilities and the hospitals. But in order to be truly ready to further release restrictions and allow more people to interact with one another in our county, the hospitals are going to have a more reliable source to replenish their PPE that is less dependent on the state and the feds. And so that's really the supply chain issue. When there's evidence that our supply chains are more reliable for our skilled nursing facilities and for our hospitals, and that those supply chains will remain in place to replenish use during increase in cases, more hospital beds being filled, more people with, unfortunately, we might have more people with COVID in skilled nursing facilities, which require more of the staff to wear PPE, and they start burning through their PPE faster. If we have reliable vendor sources for those healthcare facilities, that would be an indication that we're ready to move forward in this pandemic and release more further restrictions. So, Maya, that's I know that was a lot, but I'm going to stop there and hand it back to you.
Thank you. And we've got a lot of questions for you, although I think you were able to answer some of these questions, but we'll go through them and see what's left. The first question is regarding a statement made during the Board of Supervisors meeting yesterday about a late summer or fall peak surge. The question is, how was that conclusion made, and what implications does a later surge have for possibly lifting the shelter-in-place order?
Also, thanks. So I didn't make that statement, but what I can say about working with the hospitals to prepare for surge, and working with the hospitals to prepare for surge, we used a University of Pennsylvania model. We didn't create the formula in the model, but it's one of many that are out there, and we put in local data and share that with the hospitals, and the Board of Supervisors were made aware of it, and that it basically showed that there was a possibility that that a surge could occur, and if it did occur, it might happen end of May, early June. And so just looking at the numbers of hospitalized patients that are hospitalized for COVID-19, I would say that it doesn't appear that there will be an increase, a surge end of May, beginning of June, as the model outcomes showed. So it would make sense for hospitals or the EOC planning any alternative care site to take that into consideration, along with other data that they have and tools that they have available to them to plan accordingly.
Thank you. And another question for you. How many total COVID-19 tests can Monterey County perform daily at all the sites and hospitals? And I think the question is not necessarily that we're performing the test, but how many tests can be performed at all the sites that are testing? And do you know how many people on average are being tested? And are we able to test 1.5 people per 1,000 daily?
So yeah, that's a very reasonable question. What I can tell you is what I can share with you what capacity I'm aware of. I know that our laboratory can perform up to 120 tests a day, and we have right now our supplies have improved. So we're not, if we have to do 120 a day, at this point we're not concerned about running out of test material, test kits. So I'm very happy that we're in a much better place than we were a couple of months ago, where we were looking at maybe 2 weeks supply at a time. So we're beyond that, and we've increased our capacity. So 120 a day there, up to 120. And we know that each of the two Optum sites can do up to 132 tests a day. So so it looks like we've got, real quick, 374. We could, just in those Optum sites in our public health lab, we can do 374, which is about half, or maybe a little more than half of the total capacity that we would need to have to demonstrate that we're ready to move on in this recovery process. What I can't speak to is the hospital's capacity. They are still, even though they have test machines, they have test kits, they're still dependent upon, in large part, on some deliveries from the state, but also dependent on the supply of test kits from their vendors. And so that's an area that I don't have up-to-date information. My laboratory director has some understanding of which hospitals have certain type of equipment to do tests, but their supply, the hospital supplies are really, they vary from week to week depending on the supply chain availability. So, but I'm very happy that we have made progress, and Optum has, our lab director, Don Ferguson, has done a great job in securing additional test kits and equipment to run tests to get us to higher capacity. But as it is, we have right now more capacity than, at least in Optum sites in our laboratory, than we're testing. So we really need more people who, particularly if you have mild symptoms and you're worried that you might have COVID and you might be exposing someone in your household, or you're working and you're concerned that you might be exposing some of your coworkers, to take advantage of the Optum sites, sign up, get tested, and get your test results back. Thank you, ma'am.
Thank you. And here's a question also related on the Optum sites. How long can we keep the testing sites at Alisal High and in Greenfield open with the amount of tests we have for people going to those sites? And I think these are these are state supported sites, correct?
That's correct. So the governor's testing task force, led by Dr. Charity Dean at the California Department of Public Health, has let us know that they are committed to at least 2 months, 60 days of testing. But they've, for local planning purposes, they reassured us that we should go ahead and plan on having these test locations available to Monterey County beyond the 60 days. which is helpful for us for planning purposes, so we can make more commitments to try to get people to go to Optum in addition to their provider, if the provider's testing, or if our local health departments.
Thank you, Dr. Moreno. Here's another question on available testing. Is the county, how is the county prioritizing available tests, and how soon will the question is, how soon will the general public be able to get tests even if they're asymptomatic? I think you mentioned now that the testing sites are open to everyone.
Yeah, sure. That's a good question, an opportunity to provide additional clarification. So if an individual in talking with their primary care provider determines that they need to seek healthcare because they're not feeling well and they think they might have COVID-19, if they go to their primary care provider that provides swabs and sends swabs for testing, or they go to the emergency department, people should keep in mind that they're still seeking healthcare. So that hasn't changed. So if you go to the emergency department, you're going to be seen by a healthcare provider, and the healthcare provider is going to assess you to find out how you're feeling, what your symptoms are, examine you, determine what may be causing your symptoms, and make a recommendation to whether or not to do any testing such as chest x-rays or blood work, to write prescriptions, and including testing, whether or not to test for COVID-19, for influenza, or other viruses that can cause respiratory symptoms. And so if you go to the emergency department, you're going there for medical evaluation. So you'll still get the medical evaluation. But I think it's important for people to understand that if you have mild or no symptoms, and you don't think that you need to have a physician examine you and run tests on you, then that's where the Optum test sites come in. And I really encourage people to take advantage of the Optum test sites, because although there are healthcare providers at Optum locations, they are asking questions about fever, cough, shortness of breath. They're not going to charge you for a physical exam or for testing. They're going to test you because that's what you signed up for. So if you go to an Optum test site, you make an appointment, you're going to get tested. If you go to a hospital, there's a good chance you'll get tested if you have symptoms, but you're going to also get the full physical exam. So keep that in mind as you're deciding. If you're thinking you need a test for COVID-19, keep in mind that there's a difference between going to the hospital and going to an Optum test site.
Yeah, and another question related to testing: can people without symptoms get tested? And we've had this question on social media: can someone be tested more than once?
So at the Optum, at a healthcare provider such as an emergency room, where the hospital's there they'll accept and register anyone that comes in. I mean, I've heard that said. I think our previous presenter said they're there for our community, and they'll decide whether or not to do a test. And we are encouraging the health department is encouraging our emergency room physicians to go ahead and test. We have capacity at our public health lab to do tests. So if they have patients with mild symptoms who don't need hospitalization, we welcome those swabs to be sent over to our laboratory, or the hospital can decide to run it in their laboratory. But for people who don't have symptoms, if you don't have any symptoms at all, and you want to be tested because you have someone at home who's older or has a chronic medical condition, and you're concerned, you wouldn't want to infect that household member if you were infectious, and you don't have symptoms, then Optum test sites are really the best option for a person like that. So Optum test sites are open to the general public. You don't have to be a healthcare worker or a first responder to make an appointment. You can make an appointment, and they'll ask you if you have symptoms when you enroll or make an appointment to get tested, but you won't be denied the appointment. But if you don't have any symptoms, go ahead and take advantage of Optum while to make sure that we have enough people using the Optum test sites so that the state doesn't change its mind and pull an Optum test site out of Monterey County and give it to another county. So really encourage people who don't have symptoms to sign up. And again, you don't have to have insurance. If you have insurance, they'll bill your insurance, but they're not going to charge you anything out of your pocket for the test.
Thank you, Dr. Moreno. And I have some questions that are coming in about surge and surge capacity, and you did address it in relation to, working with the hospitals, but would you be able to define the maximum surge and what it could look like in Monterey County?
So I can't define the maximum surge because we don't know what the maximum surge is going to be. No one can predict that or tell the future. All we have available to us are our experience that we actually have here in Monterey County with the number of people that are hospitalized, number of ICU patients that have been, or patients that have needed ICU care, number of deaths. We have our local data, and we have models that our research institutions in the United States have put out. So so no one can predict the future, but we do want to take advantage of every tool and data set that we have available to us to share that, try to interpret it and share it with the hospitals, so our hospital system can make decisions as to how best to prepare for a possible event where we see a significant increase in hospitalizations.
Thank you. And I have another question. I'm not sure if this is a question for you or possibly the hospitals, but what problems have the county or hospitals encountered with non-state or federal sources of equipment? Has any equipment been seized by the state or federal government?
So the challenge that we've had with our vendor sources is that there's the demand exceeds the supply. And so whenever that happens, people's orders or orders that are submitted by healthcare facilities to their regular vendors for hospital supplies aren't fully met. And that's because early on when we're not in a pandemic, the supply chain is ramped up and operational to just meet the demand needs of our healthcare facilities. Early on in this pandemic, we didn't know a lot about the virus. We knew people were getting sick, getting hospitalized, people were dying. And so public health officials at the state and national and globally levels made recommendations to protect healthcare workers until we knew more about COVID-19. And so that's when we started the demand for personal protective equipment really went up, and the supply couldn't keep up. And so since then, we have taken measures to conserve our personal protective equipment at each of our healthcare facilities. And the supply has increased. So the demand is, and supply are beginning to come closer together. And so those are the challenges we've had. And that's part of the reason why we've heard so many healthcare workers express concern that some feel like they may not have enough PPE to protect themselves. But our local hospitals, fortunately, have done a great job in conserving PPE by changing their operations to limit the number of hospital care workers that need to use PPE throughout all of their shifts. And so they've done a good job at slowly starting to rebuild their reserves for PPE. I'm unaware of any state or federal agencies that have confiscated or commandeered any local resources.
Thank you. Another question on testing capacity. Does the testing capacity at hospitals count towards meeting the state criteria of testing 600 people a day?
Yes, it definitely would. And that's left up to, the state's left that up to local jurisdictions to work together with all agencies that are making testing available to the public to determine what the total capacity is. So capacity is how many you can do a day, but it also depends on how long could you do that. So right now we can test up to 120 people a day in our public health laboratory. At this point, we can sustain that for 1 to 2 months, which is better than before, where we were doing up to 20 or 40 a day. and maybe had 2 weeks supply. So things have really improved in our public health laboratory. The hospitals will definitely be added into that. And so, as we're building capacity, we need more people to utilize those services. So again, I'm really asking for people who are out there who might have mild symptoms or don't have any symptoms to take advantage of all the opportunities that we have now in Monterey County to get tested.
Thank you, Dr. Moreno. And I see, I'm hoping Undersheriff Monod is still on the line. I have a question for him about how the sheriff's office might be addressing concerns about golf courses allowing reservations from people outside of the county.
So I don't know if Dr. Moreno wants to chime in on that one too. Unfortunately, he seems to get that question, and you know, the undersheriff obviously can answer, but the first question is whether there's any enforcement issues that have arisen related to that. Plus I think, as Dr. Moreno says, is that we are strongly encouraging no travel to Monterey County to golf, but we haven't made an imposition on the golf courses to say that you must exclude someone who is from out of town. I don't know if Dr. Moreno has anything to add on that.
No, that's correct, Charles. Thank you.
Okay, that's everybody's on that one.
Yeah, I didn't mean to steal the other sheriff's thunder there,
no.
but
Oh, he looks like he doesn't look mad. So following up on some of our other questions, since we just have a couple of minutes left, this was a question for Dr. Moreno about being tested at Optum and if you could be tested more than once. And I'm not sure that you indicated whether someone could be tested more than once.
Yeah, thank you. I forgot to answer that part of the question. So yes. So I do attend regular Optum meetings with other health officers and health directors statewide, and that issue did come up. And there are cases where a person has signed up, and I'll give just one example. A person signed up, and the test was equivocal, which means the laboratory couldn't definitively say if it was a positive test or a negative test, and people in those situations are encouraged to go back and make another appointment to sign up, and they've been able to schedule further appointments. So from what I understand, if you go to Optum and you get tested and you're negative, but at some point in the future you develop symptoms of COVID-19, you should be able to schedule another appointment. Just as a point I want to make, and that is, if a person, any one of us, goes to Optum or goes to our healthcare provider and gets tested for COVID-19, what it means is you can be fairly, those tests are fairly reliable, and you can assume that you don't have COVID-19 at that time. However, it doesn't mean that you're immune to COVID-19. At any point in the future, if you get exposed to someone who has COVID-19, who wasn't covering their face when they're in public, and you got exposed, you could still come down with COVID-19, even though you tested negative for the virus in the past. So people need to keep that in mind. It only means that you're not infected at that moment, but you can still get infected in the future. So if you develop symptoms after you get a negative test and you think it's COVID-19, I would recommend getting tested again.
Thank you. And this is a question dovetails into your readiness issues that you were talking about. Is there a plan being worked on or in place when the governor gives the green light for opening restaurants?
So yes, thank you. So right, so we're looking at awaiting the future announcements by the governor. Some of this is some of these announcements that the governor makes, fortunately, have been discussed in regular meetings with California Department of Public Health, State Health Officer, her deputies, as we provide the state's, our local health officer provides some input to the state and the governor and his team as to what that might look like at the local level should the governor move forward with those. So we have some discussions, we have some forewarning, but when it comes down to it, we really don't know what the governor is going to do until it's actually put out there in public. So we do have those discussions at the state level with our colleagues, and then we're also looking at, as I mentioned, with the readiness criteria. We're working with the hospitals, we're working with our epidemiologists, we're working with our skilled nursing facilities, we're working with the Emergency Operations Center to look at supply chains for personal protective equipment, to continue to work towards and implement new strategies to get us closer to a level of readiness that means that it's reasonable and it's time to release further restrictions.
Yeah, I would just add into that. I think to follow on what Dr. Moreno said, that meeting those criteria means that we have the resources here, that we're ready to, that we're ready to address any situations that arise if there was a surge based on opening, as well as just saying that we have the, that we can be safe enough here locally to open. And with that, when you're talking about restaurants, are the restaurants have to meet a lot of criteria by the state, that the state has put out as far as guidance for those restaurants to open. So that's a key piece of this, making sure that they can meet those guidelines that the state put forward. With that, the County Board of Supervisors ad hoc committee on hospitality is working with the hospitality industry to make sure that they have those, the ability to meet those guidelines, as well as with the members of the various groups like the chambers of commerce and other industry groups to see what kind of protocols they can have in place so that they are ready to open if the governor says we can go, and then if we meet all the variance criteria.
Thank you, Charles. And then I only have a couple of minutes left here, but there were a lot of questions about projections. And then there was a question about how the CHIME model is being used as a tool for planning. And I wondered if Dr. Moreno, you might want to explain that one again, considering so many questions about projections and surge.
Right. So again, no one can predict the future, but we have to use whatever tools are presented to us. And in order for planning purposes to help and assist the hospitals in deciding how many additional beds they need to prepare in the event of a surge. And so we have that information, we share it with the hospitals, and I think I understand a lot of people asking about it, but again, it's primarily for hospital planning, and so they can see what a curve might look like, how rapidly the number of cases might increase, and then go from there. So again, we're just not predicting the future, we're just using information that's available to us and interpreting it the best we can, and then moving forward with the best data we have, and which includes our actual experience with hospitalizations, with cases, ICU bed stays, and deaths. So that's how we've been using it, and if it continues to be helpful to the hospitals, we'll continue to inform them.
Thank you, Dr. Moreno. And our hour is just up now. Thank you all for joining us on the media call today. Our next call will be on Friday, and we'll see you then.